Okay, so we're going to talk about the effects of pregnancy on other body systems in this section. So first of all, the renal system, the kidneys and ureters dilate. The increasing abdominal pressure actually causes urine to be retained in the renal pelvis and the ureters, which increases the risk of infection. So we have urine that takes longer to get to the bladder because of pressure. Also, bladder irritability, nocturia, frequency, and urgency are really common in pregnancy. It's associated to some extent with the pressure of the growing uterus. In the first trimester, there may be some hormonal effects. Sometimes it gets better in the second trimester, and then as the uterus grows in the third trimester, it gets worse. So it's really common. The bladder is more relaxed, and so bladder capacity is increased, which is helpful if you're making a whole lot more urine. The glomerular filtration rate and renal plasma flow increase. So we actually are putting more blood through the kidneys, able to make more urine. Blood and electrolyte concentration in urine changes a little bit. Dependent edema is really common. So it's very common, normal variation to see some swelling in the feet. Okay, if we're getting 2+ and 3+ swelling in the feet, that's too much. But some trace to 1+ edema, not uncommon. Swelling in the hands and face is a sign of potentially preeclampsia. So when people talk about swelling in pregnancy, you want to know where that is and how severe it is. So some mild to moderate swelling in dependent areas is not necessarily abnormal. We start swelling everywhere, it's a problem. Okay. Proteinuria is not normal in pregnancy. So on that UA, they're looking for protein at every visit. Protein in the urine is not normal in pregnancy. It can be a sign of a complication called preeclampsia. The skin and tegumentary system. Hyperpigmentation is one of the common effects of pregnancy hormones. The nipples and areola tend to get darker. Some women or some people who are pregnant will have darkening skin in the axilla, and sometimes the skin of the vulva gets darker. Cloasma is a term for mask of pregnancy, and it's patches of darker skin across the face. And then there's for some people extending from the umbilicus down toward the pubic bone, they'll have a dark line up here that's called the linea nigra. That doesn't always happen. Those changes, especially the linea nigra, tends to be permanent. Stretch marks, striae gravidarum, are common, and that's from growth that is too rapid for the skin to stretch to keep up. Angiomas, little spider veins, can occur. Palmar erythema, because of increased blood flow, and is not uncommon. So red palms. General itchiness is not uncommon, and there are some conditions in pregnancy that can cause severe itching. Hair and nail growth may be accelerated. Increased metabolic rate, increased blood flow, and progesterone all lead to a somewhat increased body temperature and increased sweating. And a lot of people, when they're pregnant, feel like they're carrying around this internal heater. They're always like 20 degrees hotter than everyone else. The musculoskeletal system. As the abdomen grows, it actually tilts the pelvis forward somewhat, and the abdominal muscles have decreased tone because of that weight. So lordosis, or kind of swaying in of the lower back, is common. It's called lordosis of pregnancy. Back pain, numbness, and weakness of upper extremities can occur. One of the things that happens in the skeletal system is all the joints relax because of relaxin. Relaxin relaxes the joints of the pelvic bones to make delivery easier. It allows the pelvic bones to shift slightly during labor. But that relaxin kicks in earlier, and so sometimes even before they're showing, even before the pregnancy is visible, you might notice a change in gait, kind of a waddling gait, and that's due to relaxin. If that relaxation due to relaxin is excessive, The symphysis pubis can actually separate, and that causes pretty severe pain. The abdominal muscles stretch as pregnancy grows. Sometimes they stretch enough to separate in the third trimester. That's called diastasis recti. The neurologic system, pressure from the uterus or swelling can put pressure on nerves, causing pain, tingling, and other symptoms. Carpal tunnel is not uncommon from some slight internal swelling. Sciatic nerve pain is common because the uterus sometimes gets on the sciatic nerve. Headaches are common due to stress and increased congestion, but headaches that are severe or don't improve with over-the-counter meds are potentially a danger sign. Dizziness and syncope are common because of postural hypotension and hypoglycemia. In the first trimester, hypoglycemia is not uncommon. Muscle cramps may happen because if we don't keep up with calcium intake. GI system, the basal metabolic rate increases. And so weight loss is really common in the first trimester. For one, some people have a lot of nausea, vomiting, have a hard time getting enough in, but even without decreased intake, even with increased intake in the first trimester and without nausea, vomiting, then some women still will lose weight in the first trimester. And that's because of that increased metabolic rate. Nausea, vomiting is common in the first trimester. It's due to HCG. Also, there are some changes in the way we metabolize carbohydrates. And so hypoglycemia can happen sometimes. Peristalsis slows down, so food may sit in the gut, in the stomach longer. Usually that's better by the second trimester. If it is severe and ongoing, it actually can increase risk. And that's called hyperemesis gravidarum. Cravings for foods or for non-food substances are not uncommon, and aversions are very common. Cravings for non-food substances are called pica. And sometimes they're an indication of a nutrient deficiency. The gums tend to bleed more easily. Sometimes women will have a hard time brushing their teeth because of excess saliva and gagging. And so they have a hard time brushing their teeth well, and their gums are a little bit swollen. And so you can end up with some gum disease if we're not careful. Tylism is excess production of saliva. Tends to go along with the morning sickness thing. The smooth muscle in the GI tract relaxes. So we can get some heartburn because the sphincter between the esophagus and the stomach relaxes. There's an increased risk of hiatal hernia where the stomach gets pushed up too high into where the esophagus is belonging. And that smooth muscle relaxation causes constipation for some women. The gallbladder tends to empty more slowly, and the bile is thicker, and so gallstones are a relatively common thing. It's not an uncommon thing. Cholestasis, the gallbladder not emptying well, can lead to a severe itching condition. The appendix is displaced. And why does that matter? Why do we need to know where the appendix is? Well, if we have someone having abdominal pain and we're expecting that appendix is right lower quadrant, if the appendix is displaced high and further to the right, we might not recognize that symptom. So be aware in pregnancy that the appendix gets displaced higher and to the right. Okay, in the next section, we're going to talk about the psychosocial adaptation to pregnancy.